Hello everybody. This is the first video for the pathology of the respiratory system. In this video, we'll talk about two very important diseases, two diseases. We'll talk about asthma and pneumonia. First of all, is the bronchial asthma. What is bronchial asthma? Actually, the bronchial asthma is an inflammation in the airway. This inflammation leads to obstruction in the airflow and bronchial responsiveness for different stimuli. This is what happens. This is the normal airway, and this is the airway in case of bronchial asthma. What happens is that the smooth muscles on the wall contracts, which causes obstruction of the airway, and actually the mucus secretion inside the tube itself increases, which makes breathing more difficult. What's the cause of this inflammation? Actually, the main cause is allergy. It's hypersensitivity of your respiratory system to specific allergens differ. Those allergens might be smoking, might be the fur or hair of animals, pollens, specific treatments, or even in some cases the hot weather. But actually, there is a genetic factor on developing this disease. What's the symptoms? The main symptoms of the disease is wheezy chest. It's like a whistling sound during breathing due to difficulty in doing this, cough, shortness of breath, dyspnea, and tight chest. What's the treatment for this case? Actually, this disease is controllable but not curable. You cannot remove it totally. But you can control the symptoms and make the life of patients somehow easier. The other thing is that the treatment depends on the severity of the case. If it's mild and not permanent, it will be different from if it's mild persistent, moderate persistent, or severe persistent. The other thing is that the treatment depends on the time. The treatment during the attack differs from the treatment between the attacks. But generally speaking, the treatment is, the first thing is from the patients. If he is able to avoid the allergen, it would be much better. And for the chemical medications, they are generally bronchodilators, something that dilate the obstructed bronchi, corticosteroids, anti-inflammatory treatments in general, and anti-leukotrienes. Anti-leukotrienes are substances that stimulate bronchoconstriction, smooth muscle constriction in generally, and they have a role in immunity. So so anti-leukotrienes treatments help to relieve the asthma. This is for bronchial asthma. The second disease is pneumonia. What is pneumonia? Pneumonia is also an inflammation, but it's an acute inflammation in the lung tissue itself, the lung parenchyma, and mainly it's caused by infection. Whatever type of infection, bacterial, viral infection, fungal infection, or parasitic infection in general. What happens is that this microorganism, whatever it is, could escape all the defense mechanism above the alveoli in your respiratory system and reaches the alveoli. Upon reaching the alveoli, your immunity attacks this microorganism, and due to this inflammatory response, actually the fluid and blood accumulate in the cells of alveoli, which makes the respiration much difficult. What's the symptoms for this? Fever and headache, cough, shortness of breath, also dyspnea, and chest pain. Investigation, there is a very important thing that's characteristic for pneumonia patient. Actually, it's X-ray. Normally, in the normal cases, your lung should appear in black color because it's only filled with air, which appears black in the X-ray. Only the normal thing is this spot, it's so hot. But any other white color indicates that the existence of fluid, whatever it is, blood, water, anything, in your lung, which is abnormal. So the presence of such white patch is characteristic for pneumonia. The complications, actually pneumonia is a very dangerous, not mainly for the disease itself, but for complications. They are different, and they can affect only the lung or the whole body. One thing is the bacteremia. If the bacteria or the microorganism that causes infection move to your blood, it can infect any other organ, which is very dangerous. Another thing is the lung abscess due to the inflammatory response, accumulation of blood and water and fluids. Or it can be emboyema. Emboyema is accumulation of pus in your lung tissue. It can be pleural effusion. Again, it's accumulation of water in the pleural cavity. Or meningitis. Meningitis is due to the infection that caused by transmitting the bacteria or the microorganism to your blood. So it's very dangerous, and those complications occur in case of delay of treatment or deficiency in it. This is for and the final thing is respiratory failure in severe cases. How do doctors treat this disease? It depends mainly on the type of infection. First thing, if it's bacteria, the patients will be given antibiotics. If it's fungus, it will be given antifungal, and so on. The second thing is that patients are given fluid and electrolyte replacement. Also, the patients are given respiratory support such as oxygen and mechanical ventilation, and the final thing is analgesics. This is for this video. Hopefully, it's useful. Those are our references, and thank you.